Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. I'm here with a special guest today, Mike Andrade. Hi, Mike.
Hey, Dr. Ashaye, it's great to see you again. Thanks for having me on this episode.
Yes, it's really a pleasure to have you here again. So, Mike is an
Likewise.
independent benefits advisor, and he's been doing this since 1993. And what he does is he helps design health benefits that can reduce healthcare spending by 10 to 40% while achieving better outcomes. So, this is really important for a lot of people, especially business owners who may be looking for healthcare options. So I wanted to talk about this because I have a lot of business owners in my practice, and I want to share with you ways that you can get a health plan so that you don't delay your care because it's so important. Okay, but before we get into it, if you have not already, go ahead and subscribe. It really does help people know about us. They can see this information so that they can also learn from it. If you are benefiting from it, other people can too. All right, so we're going to go into it. So, Mike, can you tell us a little bit more about yourself and why you became a benefits advisor?
Sure. So I've first of all been in Texas now, I can say over half my life. And see by the gray hair that you're probably going, okay, that's a couple of decades. It's almost almost, oh no, it's 2.5 decades I've been in Texas. And I got into the benefits space really by accident. So I found when I was in college, I was really good at math. And so I became an underwriter. And then in my career, I realized that, you know what, I actually like talking with people. And on top of that, I like helping people. And so uh, the practice itself of being an underwriter helped me develop, I would say, a way of thinking. And the want to help people helped me organize my thoughts around a strategy for about how to do just that. And so I love being in my space because, like what you do, there's a specific language that you have to help people. And in anything where you're talking specialization, health insurance is complicated. So is health care. So just having that specialized knowledge that I've had for 3+ decades, I'm just really grateful that I've been able to help individuals, help businesses, and help people like you succeed.
Thank you. Yeah, thank you for being here all this time. Much needed service. Okay, so there are business owners listening to this, and can you tell a story about how you've helped maybe a small or mid-sized business reduce their spending on healthcare? Because a lot of them really complain about the cost of healthcare as a barrier to care. So can you share a story about that?
Oh, sure. First, I want to just say that right about now, if a group has a January 1st renewal, you should already be working with your advisor on what your renewal strategy would be for January 1st. If you're a smaller business, you're probably just now getting those renewal indications. And what I found is that for like small businesses, you'd be surprised at how sometimes something very simple can help reveal opportunity or strategy. And what I always say is, within the steps of getting your arms around cost control, it's understanding where you're at right now. And if most small businesses don't realize that they have access to what's called claim experience, premium and claim experience. And so really just sometimes the first step is just getting your claim experience and seeing, do we have an opportunity based on our loss ratio to add value? You'd be surprised how many people don't realize that they're spending all this money on premium
Mm.
and they really spend nothing in claims. And so when it comes to how do we make the best use of that premium, that's the first step. And so just I would say 3 weeks ago, I was able to help a customer just by getting information they didn't know existed, and by there just revealing by better using some of the markets that are out there, giving them more effective cost containment features. I also want to say that a lot of folks complain about cost, and cost. Yeah, health insurance is super expensive, and cost is certainly an indicator of value. But I would also say the overall benefits and the cost this has is weigh in as well. I think we joked around earlier about you can always buy a cheaper car, but would you want to drive it? And the same thing would apply for healthcare. It's a cultural thing that you want to make sure you've got it good, or at least have options for your folks, good or good enough, so that it can also reflects on your culture as well.
Right. That's interesting. And we're going to talk more about that too. So what healthcare options are actually available for business owners? Like how, I know there are a lot of them, but how would you categorize them and how should they be thinking about them?
Yeah, I would say first and foremost, start out, it's understanding where you're at, not just necessarily with your claim experience, but also as a business owner. Small businesses have different markets than larger businesses would have access. Middle-sized, mid-market companies as well will have probably some additional options that a small business wouldn't consider, and a large business couldn't consider because they can't move fast enough for some of the innovation that's available in local marketplaces. And then if you're a super large business, the markets that you have available would be like your traditional Blue Cross, United, Cigna, Aetna, and others. Um, but the difference really lies in understanding where you're at right now. So small businesses, as an example, may not want to provide health insurance at all, and they might want to consider doing what I call health assurance. And that could be, hey, we need to provide access to something that gives them your employees the protection that they want from insurance, but it may not be insurance. A good example of that is what we found works super effective is having somebody like you, a direct primary care physician that can provide all primary care, access to lower cost prescriptions, and a host of other things that most people don't realize are such tremendous benefits with direct primary care. And then consider bundling that with a health sharing arrangement, or consider offering that as an option. And if somebody has access to spousal coverage, let them enroll in that. And so many times you can take that same dollar and redeploy it and give folks assurance of health without necessarily providing the expense of health insurance. Um, with When you get to mid-market sized businesses, most folks think, wow, I've got 4 choices and they're all super expensive. And what we're seeing is in the marketplace, quite a few options that actually tailor to small businesses, use their claim experience. And that might be something that would be called like a self-funded or level funded option, something that might sound scary, but with the right administrator, with the right reinsurance company to back up your offering, it's not something to be scared about. And what I would say is, in your space, Dr. Ashaye, there are definite markets that are embracing direct primary care as a central point of delivery of healthcare, because we know it works when it comes to chronic condition management and even prescription drug management. And in some cases, when you have somebody that's super sick, having you in their corner is truly remarkable and just a testament for the value you provide to your customers.
Yeah, thank you. Yeah, and I think, you mentioned that the value is
Mhm.
very important as well as we consider cost. So feedback I've received, I speak to a lot of business owners, many of them are my patients, and
Mhm.
a lot of times, especially before they join us, they have questions about how they can compare different types of plans. And as you know, it's not straightforward. Everybody's different. Every plan is a little different. Is there a simple way that you would recommend that they think about it? Maybe some kind of format or tool or whatever you think can help business owners kind of, block out the noise and figure out what will work best for them.
Sure. Now, the Affordable Care Act basically set in motion, this is in 2014, standards for healthcare value. And they basically said, hey, we're going to put healthcare into buckets of bronze, silver, gold, and platinum. And so many health plans, they all, if it's a traditional health coverage or a one that's through a traditional health channel, they'll have a value rating for that. It'll be bronze, silver, gold, or platinum. And so that's a super high level way to compare overall value. So you can look at your premium cost relative to the what the plan is labeled from a metallic perspective. But even within the bronze and silver rating, you still have quite a bit of difference between what your deductible and out-of-pocket expenses might be. And so there's not like a steadfast way you can say, okay, compare this super fast. However, what I would say is you certainly want to keep in mind the premium that you pay. You want to keep in mind what your out-of-pocket expenses will be in the case something super bad happens. But then you also want to make sure that things that you might not even think about are included in your plan, like hospitalization, specialty prescription drugs, any limitations on the plan that you might have if you're looking at something that's not a traditional health plan. What I would also say is that right now in this market, there's a lot of innovation that is happening with, might be off label or companies that you might have not recognized, but they still have amazing products. And so there's quite a few, Dr. Ashaye, that are embracing direct primary care as a central theme. And so when the difficulty that we've had in the past is taking what looks and smells like traditional health coverage and putting something where you are the central point of value. It's been really hard to compare that because there hasn't been a lot of things in existence. And so you either have to say, hey, let's look at your premium rate, United Healthcare, let's plug in the membership fees for Dr. Ashaye, and then hope that we have value produced when we have the combination of the two. And there's nothing wrong with that strategy at all. However, there are emerging markets where they say, hey, look, we realize there's value in direct primary care. First and foremost, because you're not beholden to a healthcare system that requires you to send people within the system for referrals, that requires you to do certain things that may not be good medicine, but they'll certainly add revenue to that healthcare system. And that's one of the tremendous value points that you bring to the table, is that you won't play in that game. You're going to give value to your patients first. So what I would say is it's becoming a lot more easy to make those comparisons because of the innovations that are in the marketplace. And so if you're a small business, or you've got a lot of folks locally and you're a mid-market size business, those options are available to you right now. It's just, you should have somebody in your corner, an advisor that knows how to get that information and help walk you through what it will look like right now, this next year, and in future years.
Yeah. Yeah. Thank you for saying that, because I think people maybe they find out health insurance is expensive and then they just decide that they cannot get health care. But it's nice to know that there are options out there and it is possible for you to still have medical care, outside of the traditional health insurance design. So, okay. So we're at InTouch Primary Care, and what we do here is we provide medical care to people at different stages of life. And I'm a family medicine doctor, which means I do primary care. And I wanted to talk about DPC, direct primary care, because that is a way we've been able to help a lot of business owners. And from your experience, you have had experience with direct primary care practices too, and you've been able to help design plans around direct primary care. How do you think DPC can help a business owner?
Well, first and foremost, it is being able to offer your folks an experience, kind of like when I was a kid. Now, I'm a lot older than you are, and when I was a kid, we had Dr. Corey, and Dr. Corey was our family doctor. And anytime anything happened, we could pick up the phone and go talk to Dr. Corey. And I remember one time I got this scar on my head. I ended up hitting a door frame, tripping, and having a gash in my head like this big. And we didn't go to the emergency room. We called Dr. Corey first. And you know what? We met in his office, and he stitched me up, made me look like an Indian, put a cool little feather in my bandage.
Yeah.
And you know what? I got to experience medicine the way it should be. And what I will say is, first and foremost, that is what I think most business owners want, is they want to give their employees something that they know they can get value out of. You can't get that in traditional medicine or traditional health insurance, but you can get that through companies like yours, because you're available 24/7 for your patients. And if somebody has a stitch and you agree and they agree that it's right for them to come to your office for whatever, then you would do that. But then also you pick up the phone, it's 24/7 access. And so that's such a tremendous benefit that most people don't realize. Think about it. If you're in a traditional healthcare system right now and I'm sick, it might take me to 2 or 3 weeks
Right.
to see my doctor, and I might be healed or dead by then. And so for me, just being able to text my doctor and not text my nurse or text somebody else, but I text you, and then you respond back to me with, hey, let's send me a picture of that, or let's do this, we'll do that. Maybe you should come to my office. There's so much value in that. Think about how much time that we all stress over how we don't have. And giving that level of healthcare certainty is tremendously valuable. Now, I'll tell you a story. We're doing something right now with a client of mine that has about 1,000 employees across the southeast part of the United States. And right now, the technology exists to essentially assemble a framework of direct primary care physicians. And so essentially, we give access to a DPC doctor in every marketplace where these folks have people. And so we're essentially building a plan around DPC so folks can choose that. It's a lower cost option because we know when somebody comes to see you, you're going to have a higher level of care to the limit of your license. So you're going to be practicing medicine like family physicians should and not incentivized to send folks to a specialist. When I need to see a specialist, you're going to help me pick the right specialist, not just the one that happens to be in the hospital system that the hospital system says I must see.
Right.
And when it comes to prescription meds, you're going to be very practical. And in many cases, DPC practices around the country can dispense medicine from their office. And so those things all add up to a more convenient experience, lower cost experience. And I'm just excited that we're able to do this because this is a large customer that is saying, look, I believe that we can make a difference in the lives of our employees. And we're going to have to pay a little bit of a membership fee up front. But when you look at the potential impact, improve chronic condition management, improve prescriptions, less specialist visits because they see you,
Right.
it's a tremendous outcome, and just very excited about the potential that this transformation will have for this customer.
Yeah. Thank you for sharing that. And I think also I'm excited about the options it gives to business owners because that was a problem that I noticed when I was in the traditional healthcare system, where people were scared to start their own businesses because they were worried about the healthcare piece, or business owners delayed their care because they just didn't understand that there were options outside of the traditional healthcare options. So,
Yeah, you're right about that. I mean, for individual businesses, you have many options that are available. And we talked about you plus health sharing. And for individual, that's a great option because you need to understand what you're buying before you jump into it. But that leverage of having you for almost everything, and
right.
then having a solution to provide a shared experience, meaning the cost is shared with others. Those two in combination work well for individuals, for small businesses, and small businesses that are at that. And I don't know if I need to offer a health plan just yet. What are some other things that I could do? Another thing that you might want to consider if you're a business owner is there in the realm of health assurance. There are a few account-based programs that work kind of like a flexible spending account. Essentially, the employer says, hey, I'm going to put some money here.
Mm-hmm.
And whenever you have a qualified healthcare expense, you swipe your debit card and you get cash from that. That pairs very nicely with a service like yours. And especially if somebody has access to a spouse plan or a marketplace plan, that provides an even better benefit without the expense of getting into a traditional health insurance arrangement as a business owner. So there's just so many different ways and strategies that you can employ as a business. You just, first and foremost, you got to figure out where you're at right now and what's the most from where you're at right now, what are your options? And from there, what's your long-term path?
Yeah. And one other thing I'll add for small business owners is actually attracts great talent. So I've had, people call and say, hey, what do you offer? Because I have this person who wants to make sure that we have some kind of health plan because, we can't offer traditional health insurance, but if I have this plan, they're interested in coming to work with me based on that. So having something like this for business owners, you can bring people into your team. You can attract great talent in your team when you have some kind of benefit. So that can help your business as well.
Yeah, what I would offer, and you might comment on this more than me, but it's the hidden benefits that most folks don't realize. And so I just use an example of a kid, a parent that a kid wakes up in the middle of the night and does something, right? And not only do they need to see somebody right now, but they also might need a doctor's note that they forgot to get so they can go
Right.
back to school or whatever the case may be. And so it's just the benefit of having a you, it's way more than saying, yeah, I pay 50% of whatever healthcare that's super expensive. And so, yeah, those are the hidden benefits that come with having you, not just on the business owner's team, but as a part of my family health strategy.
That's right. That's right. Okay, so great. So now we're coming to the end. You've talked, about what business owners can do. What would you say their next step should be? So a small business owner might be listening, a mid-sized business owner, they
Mhm.
want to begin their journey of healthcare and getting a health plan. Where should they start today?
Well, I'd say if there was a handful of steps, step one would be know where you're at right now. And it may be that within that step, if you don't know where you're at right now, meaning you have no idea how healthy your folks are, what your claims are, that type of thing, or maybe you just don't have insurance right now and you want to know what your options are, it's a good time to start with the understanding of where you're at as a business and what is it that ultimately you want as an outcome.
Hmm.
Um, so let's just say you have somebody that doesn't offer healthcare at all to their folks. I would say the first step would be understanding what your options are and what those costs might be. Because it may be that, sponsoring a health plan, it might be out of reach for your budget ability, but having a service like yours with some type of account-based stipend or something that's other than insurance, it might be the better path. And so it's understanding where you're at right now. And then the second step would be is know where you want to go. So if you're a business that can stay small and you want to be nimble, maybe it's okay to stay right there. But if you see based on your growth trajectory, you know where you're going to go. It's really having a plan for what your benefit strategy will look like as you mature as a company. And the third thing would be to really have checkpoints along the way. Things change. Didn't think, imagine before COVID happened, nobody thought we would be stuck in our house for however long we were stuck in our house. And even now with what's going on politically and economically, there's a lot of things that are changing. And so it's important to have that philosophy, but also checkpoints along the way so that and many times if you're a small business, it's just understanding what exists for you in the future. But as you are a larger business, it's understanding how your plan is performing right now so that when it comes to this time of year, you're not super surprised by the renewal and you've got a better understanding of what your options might be.
Okay, thank you for sharing that.
Mhm.
Okay, so how can people connect with you if they've heard this and they're looking to understand where they are now? Many people would definitely need help with that. So how would they connect with you?
Sure. Well, first of all, I'm easy to find. You just type in Maverick Benefit Advisors and Fort Bend, I'll pop up. But you can also, so Mike at maverickba.com. I'm easy to find, easy to get a hold of. So that would be where I would start. I'm also on LinkedIn under Mike Andrade, Andrade. You can also call me 832-236-8966.
All right, thank you, because we'll have all that in the caption so people can find you easily. But
And
thank you.
Dr. Shea, Dr.
Yeah.
Shea, is it safe to say that a lot of the folks that you talk to are curious about maybe not so much insurance, but how somebody like you works better for them in the healthcare space? Is that a fair statement?
Yes, that's a fair statement. Absolutely.
What I would offer is that businesses that are really bent that way of saying, okay, how is it that health insurance, the traditional way we think of it, is so dang expensive? And if you look at how it's built, it's only going to get even more expensive as time goes on. And so those folks that are really interested in really that foundation of how something like your service can transform healthcare, there's a couple of organizations. One is called the Free Market Medical Association. That's one that, now, mind you, I would just say, if you just want to put your toe in the water, just check it out. You can get super geeked out by investing time there, but the Free Market Medical Association is a great place to get started. So you can see that there is an alternate universe to what most folks think is traditional healthcare. The other one is a service called Health Rosetta. That is, it's an ecosystem of folks like you and me and a bunch of other folks within the ecosystem that are all aligned to try to make healthcare more accessible and more affordable for all Americans. And so those are two services to be cognizant of. The other one is a service called Hint Health. And for those of you in the DPC space, that's a great aggregator of content and information. There's a Hint Summit that happened a few weeks ago, and that is providers, DPC providers, and a lot of folks within the community have attended that to help take that stake that's in the ground at DPC right now and to broaden it and make it more accessible for even more. So those are just great services that I would say, if you're all curious, great places to start to learn that healthcare can be different. It can be more accessible. You can use it to reward your employees and give them a gift more than just insurance. It's a gift that helps them and their family.
Oh, wow. Thank you for saying that. Yeah, I didn't even think about those things, but those resources are very helpful. And yes, we will have that information as well in the caption so people can easily access those. Thank you. All right. Well, we've come to the end. Thank you for listening. Remember to share this with any business owner that you know, especially those that might be asking questions about their healthcare plan at this moment. You never know, it could really make a huge difference for them and their team. And if you're in the Houston area, we're at InTouch Primary Care. We're here in Sugarland. Information is in the caption. You can reach us at intouchprimarycare.com. Thank you for listening and have a great day. Bye.